An Ohio critical care doctor was arrested and charged with murder Wednesday in the deaths of 25 hospital patients who authorities say were deliberately given overdoses of painkillers. Dr. William Husel, who was fired from the Columbus area Mount Carmel Health System in December and stripped of his medical license after the allegations came to light, turned himself in for an arraignment on 25 counts of murder. Franklin County Prosecutor Ron O'Brien said other medical staff who were interviewed were treated as witnesses, and he doesn't anticipate anyone else will be charged. A lawyer for Husel has said he didn't intend to kill patients. Messages seeking comment were left for that attorney. Mount Carmel Health System found Husel ordered potentially fatal drug doses for 29 patients over several years, including 5 who may have been given that pain medication when there still was a chance to improve their conditions with treatment. The hospital system said 6 more patients got doses that were excessive but likely didn't cause their deaths. Many of the deceased patients were seriously ill. Husel was fired after concerns arose, though Mount Carmel has said it should have expedited the process of investigating and removing Husel, who worked there for 5 years. The health system's officials said Husel wasn't removed from patient care until 4 weeks after a concern about him was raised last fall, and that 3 patients died during those weeks after getting excessive doses he ordered. Mount Carmel fired Husel, notified authorities, and suspended 20 employees including pharmacists and nurses who administered medication. The announcement came January after a family sued the hospital, alleging medicine was used to hasten 79-year-old Janet Kavanaugh's death. The attorney who brought the lawsuit said, in that case, either layers of safeguards repeatedly failed to flag a grossly excessive dosage of fentanyl, or the medical professionals intended to accelerate the death of Kavanaugh in late 2017. Fentanyl is a powerful opioid pain medication nearly 100 times stronger than morphine. Kavanaugh was given 1,000 micrograms of fentanyl through an IV, causing her to die in 18 minutes, the lawsuit claims. After Husel was charged, Mount Carmel officials pledged to continue cooperating with authorities. More than 24 wrongful death lawsuits have been filed against the doctor and the hospital system. Families alleged their loved ones were negligently or intentionally killed by painkiller overdoses ordered by Husel. Some also have questioned whether they were misled about the graveness of the patient's conditions. Mount Carmel has publicly apologized and already settled some of the civil cases for hundreds of thousands of dollars. On Wednesday, Mount Carmel said it has made and will continue to make meaningful changes to ensure such events never happen again. The hospital system says officials' thoughts and prayers continue to be with families of patients affected by Husel's actions. Mount Carmel operates 4 hospitals around Columbus and from parent organization Trinity Health, one of the country's largest Roman Catholic healthcare systems. Hospital system officials have said all employees who were part of administering medication for affected patients have been removed from patient care as a precaution. There were 48 nurses and pharmacists under review, were reported to their respective boards. 30 30 of those employees were put on leave and 18 no longer work there, including some who've left years ago, officials said. Share this article. Share Husel previously was a supervised resident at the Cleveland Clinic, where his work is under internal investigation. It said a preliminary review found his prescribing practices there were consistent with appropriate care. The state medical board has suspended his license. Records show no prior disciplinary action against him, and the board won't disclose whether it received any complaints that didn't result in such action. 5 states, California, Oregon, Vermont, Washington, and Colorado, allowed physician-assisted death. In such cases, physicians prescribe medications in life-ending amounts to terminally ill patients. An additional 20 states have considered, but not passed legislation to do so, according to the nonpartisan National Conference of State Legislatures.